Thank you guys so much for joining us today. Jordan and I are going to be going over facial balancing and doing a deep dive into what it is and explaining it all to you.
Be sure to stay tuned until the end for a fun giveaway. So facial balancing is using fillers, toxin, and other collagen stimulators to help balance the face. We really want everything to harmonize together to where your features aren't overpowering one of the other. You don't want your big old lips and a weak chin.
For facial balancing, we can use anything from toxins to Sculptra, which is a collagen stimulator, to then fillers. So for tox, we can assess the upper face to make sure we get a nice lift to the eyes, and then we can assess to see lower face as well to make sure we just tighten and lift as well. So if you feel like you're not a candidate for filler, we also have something called Sculptra, which is the collagen stimulator I mentioned. You can do full face Sculptra to, again, lift and pull and do the same things that filler does. However, it does take a little bit of time, but it is a really, really great product. So how many appointments are typically needed for facial balancing? So the answer is it could be one or several. So in one appointment, we'll assess to see what all you need. However, filler is always buildable. So if you come back, we can always add a little bit more, but it can be done in one session. So how do you prepare for your facial balancing appointment? So on your end, try to avoid alcohol, blood thinning products like ibuprofen or aspirin for 24 hours prior. And then after, try to do the same as well for about 24 hours. And then you can always add arnica, topical, or an oral tablet to kind of help with bruising if that is necessary.
Here is our beautiful patient, Kathy, who is now a first-time filler patient ready to have some facial balancing. Victoria is pre-marking her face, and then we're going to go in and do a little bit of toxin to help with those fine lines and wrinkles at the forehead and crow's feet and that orange peel texture at the chin. Ensuring your filler is pain-free is number one. So as you can see on Kathy's face, we will place the numbing cream while we do your toxin. Get you nice and numb. We'll use the vein finder as well prior to any filler to make sure that we can miss any bruising if at all possible. And now you can see Kathy is getting filler to her bilateral cheeks to bring back that fullness. And now Victoria is also placing some on her chin. A recessed chin is actually way more common than you may think and can be one of the key components into help bringing that facial harmony. So Victoria is placing, I believe, about 2 syringes to the chin area for Kathy, and it just completely transforms her look. She's also previously done some toxin here to help with that orange peel texture that we can all get whenever our chin is kind of pulling up more. Here, you may think that, man, that looks very painful, but again, just as you saw previous, we do have that numbing cream placed all over the face that sits for about 15 to 20 minutes prior to any fillers being injected to ensure you're nice and comfy. Same goes for the lips here. Victoria is doing a mini lip on Kathy just to add a little bit of plumpness and hydration back to her lips. Nothing overdone, just delicately done, but makes such a difference into her overall profile. And voila, Kathy is left balanced and symmetrical.
Thank you so much for joining us. Remember, everyone that attends the event is going to get a free area tox with their facial balancing treatment, and also one lucky winner is going to win a free syringe.